health and well-being. And then part 4 will be about living well with sickle cell. And then, as per usual, I like to end off with empowerment and lifestyle tips. So again, for those of you who are joining for the first time, you may not know my background. So this is, again, just a refresher for those who are new. And, for those who've heard this before, just pretend you've never heard it. You're meeting me for the first time. So just a little bit of background. As you can tell by the accent, I was born in South Africa. And experienced firsthand racism and marginalization and disempowerment under the apartheid regime. But this really helped to shape my worldview for social justice, advocacy, and empowerment. And actually, that is what helped me to continue to fight for nutrition in sickle cell. I moved to the UK in 2000 with my husband and was introduced to sickle cell in 2011. I worked in the sickle cell service from 2012 for 4 years, but it's in 2014 that I was introduced to sickle cell nutrition. And yeah, looking back, it's wonderful to see how far we've come. I wanted to make some changes in policy and practice change in sickle cell nutrition. And I was then advised by a GP at the time to do a doctorate. So I started a self-funded doctorate in 2016 and completed that at the end of 2023. And at the same time, I founded my non-profit organization called Sickle Cell Nutrition Academy, which you would have heard me speak about throughout the session so far. And currently now work as a consultant dietitian to advance sickle cell nutrition. So that brings us on to part 1, which is the recap of session 2. Now, again, for those of you who would have joined me on session 1 and session 2, this is a slide that I've shared with you in those sessions. And today I've got some question marks. So for those of you, I'm testing you. Those of you who've joined in session 1 and 2, I'm testing you. And I want to see your answers in the chat at the end. So I always like to speak about the rationale for the integration of nutrition into standard care. And there's key things that I mention as to why this is important. So there's a question mark. There's 3 question marks there. So I want to know from you, from those who've been listening and paying attention in session 1 and 2, please put in the chat, what are those factors that you can remember that are important reasons for why nutrition need to be integrated into standard care. So one of the ones that I've left there is patient experience. And this is patient experience, not only in terms of the medical management, but also in terms of your nutritional management. And the other reason why it's so important for nutrition to be integrated into standard care is so that, we can help support you live a longer life. So have a longer life expectancy, but not only living longer, but living healthier as well. So that's really important. And all of this together will work to ensure that you have positive and improved health outcomes. So I can't check the chat now, but I'm hoping that there's some answers in the chat from those who have attended session 1 and 2. And maybe at the end, I'll be able to fill in the blanks for those who may not know the answer, who's new to the course. So I've continued on the vein of leaving some, adding in some question marks again for those who've been listening in session 1 and session 2. So this slide I always include in all the presentations because there are still people asking me, is nutrition in sickle cell a thing? And people don't quite make the connection between how nutrition fits into sickle cell. And this is really important that people know that nutrition in sickle cell comes directly from the main clinical features of sickle cell disease. So again, in the green block there, I've left a question mark there. So essentially, the first clinical feature, and I won't give the name because I want people to put it in the chat. What is the clinical feature that is about the rapid breakdown or describes the rapid breakdown of red blood cells? If you know that answer, please put it in the chat. Because your colleagues on the call need to know the answer. So I'm not going to give the answer tonight because I really want people to pay attention. And the reason why that one is so important, because as you can see below, there are so many problems that's associated with this rapid breakdown of red blood cells. And many of you will experience this just in terms of chronic anemia and fatigue, the symptoms along with that, the fact that your body has to make new red blood cells on an ongoing pace. And the fact that you have this ongoing increased oxidative stress that in the long term results in chronic inflammation. So it's important that you understand what are those clinical features that result in nutrition in sickle cell disease. So on the second one there, vasoocclusion. Who knows what vasoocclusion is? Again, I've left a question mark there. So for those of you from session 1 and 2, you've been paying attention, please fill it in the chat. But again, vasoocclusion, which is the medical term for your sickle cell crisis, also results in, a number of problems that can influence the nutritional needs of sickle cell patients. And particularly, it's to do with the blood flow through the veins. So there's a reduction of blood flow, there's a blockage of blood flow, and all of this together will result in organ damage, tissue damage, and also chronic inflammation. And then in the orange block at the bottom, again, I've left a question mark. So what is the impaired functioning of the spleen? What's the impact of the impaired functioning of the spleen? Again, put it in the chat if you know. And this is important as well because the impaired functioning of the spleen means that patients living with sickle cell have an increased risk of infection and therefore an increased risk of malnutrition because they have increased nutritional requirements. And so just these 3 clinical features that I've mentioned here are some of the main reasons or causative reasons for the nutritional problems that sickle cell patients can experience. So now we're looking at why good nutrition is important, and there's another question mark that I've left in here, but essentially, good nutrition is important because we want to help you build a good nutritional status and also prevent malnutrition. And a good nutritional status is all about what's that blank. So who knows what is a good nutritional status all about? If you know the answer, put it in the chat. But essentially, it's about eating the right amounts of foods, the right quality, the right quantity, and also factoring in your cultural foods and preferences. And in session 2, we did quite a big section on looking at specific cultural foods for the African as well as the African Caribbean diet. It's also about choosing and eating the right variety of food. So you can't just eat one food every day. You have to have the variety because not one food has all the nutrients the body needs. And so a variety is important to meet your body's individual needs and allowing your body to function optimally. And also to ensure that you have a good quality of life. So that's an answer to one of the first slides there. It's important for sickle cell patients that, we help support you to achieve a good quality of life so that you can do and enjoy the things that you enjoy doing. So what's the evidence of good nutritional status? Again, I mentioned healthy, balanced diet, or that's a clue to the gap in the previous slide. And this is also looking at anthropometrical measurements, so looking at the size, proportion, and the body composition. And we do that by assessing your weight. So if you don't know your weight, I'll encourage you to check your weight and also your height. And what can we calculate with your weight and height? Again, there's a question there. So for those of you who were there here in session 1 and 2, pop the answer in the question. So we want to be able to work out and calculate a ratio that uses your weight in relation to your height. And that information will tell us, whether you have a healthy weight or not. Other things that we look out for in terms of assessing a good nutritional status is whether you've lost weight unintentionally, whether you've gained weight, and if that weight is because you've eaten more than what you normally do or because you are retaining fluid, but also inflammation. And I mentioned in the previous slide that sickle cell chronic inflammation is associated with the clinical features of sickle cell. So we look at the inflammatory markers, but also the disease burden. How does sickle cell affect you? What sort of complications do you have? So all of this information together will give us really good clues as to the quality and how good your nutritional status is. So we also spoke about in session 2 last week about key nutritional concerns and risks that you need to be aware of when you're living with sickle cell. So the 4 key nutritional concerns we identified last week was about your appetite. So when you're experiencing a reduction or in your appetite, this can be a clue, because if you don't have an appetite, it potentially means that you're not eating. And if you're not eating, potentially that can increase your risk of becoming malnourished. So you do want to pay attention about your appetite, and particularly when your appetite's reduced. And sometimes your appetite may be increased and you may need support and help with that as well. If you are losing weight unintentionally, you don't mean to lose weight, but every time you get on the scale or when you go for your appointment, you've lost weight, that's a red flag as well. So we definitely want to, pay attention and seek some help when you're experiencing that. If you are unable to gain weight after you've been unwell, again, that is another red flag. We want to know that. We want, speak to your GP, speak to your healthcare professional, your consultant or your nurse, and also, to get that seen so that we can help to prevent and reduce your risk of becoming malnourished. And then the 4th one we identified was worsening anemia and fatigue. If you have worsening of these symptoms, then definitely we need to look at it. Maybe that there is, a deterioration in your sickle cell, or there could be other reasons that we need to look at to try and prevent you from becoming malnourished. Also, we spoke about the key nutritional risks, and we mentioned 4 there. So the first one was when you're experiencing multiple or lasting infections. Again, we said earlier on that infections can increase your risk of malnutrition because it increases your nutritional requirements. So you do want to flag that up. If you have frequent hospital admissions, again, we know that patients who have hospital admissions frequently, that also increases your risk of malnutrition. So we want to flag that. When you have worsening complications of sickle cell, that can be an indication that there might be something else going on, or that can impact on your nutritional intake and increase your nutritional risk. And if you're not able to do the things that you were normally able to do, your functionality, again, you want to flag that up and be assessed so that we can prevent and reduce your risk of malnutrition, and also ensure that you have a good nutritional status. So what we also mentioned, that sickle cell nutrition is a multifactorial problem. So it's not just about the food, but there are other factors that sickle cell patients commonly experience that can also affect your nutritional choices and your nutritional behaviors. And these are some of the factors that were identified through my research project. So some personal internal and external factors, and we went through this very briefly last week. And some of those internal factors we identified were psychological problems. Some sickle cell patients may experience anxiety, stress, what's the other word, depression. And so all of these factors can definitely have an impact on, your ability to eat, your appetite, what you choose to eat, your mood, all of those things. So your attitudes as well, your beliefs around food, your culture. A stigma around sickle cell can also have an impact. Religion can have an impact, but also your health symptomology. So whether you have symptoms of anemia and fatigue, definitely that can have an impact on your ability to eat well and to make good choices, and actually to prepare food as well. And some of those external factors we mentioned was your environment, where you work, where you live. Do you have enough time to either buy the food or prepare the food? Do you have knowledge? Do you know what to do? Do you know what food to buy, etc.? Culture, food traditions, again, we said, but also peer support. Do you have access to help in terms of family and friends and so forth? So all these factors, in addition to food, are what we need to consider when we're thinking about nutrition, and ensuring that you can optimize your nutrition living with sickle cell. So we also spent quite a bit in session 2 looking at the key sickle cell related factors affecting nutrition. And we know that sickle cell is a multi-organ and system condition because blood flows everywhere. So all of the main organs and systems in the body can be affected. And we went through those slides and, went through what are those effects, how does it impact on your sickle cell, but also what you can do in terms of your diet and your nutrition to try and circumvent and improve that. So this is something to pay attention to as well when you're living with sickle cell. And then, so that's a recap of some of the main points that we spoke about in session 2. So now we'll come on to answering those questions. So there was a fair amount of questions that came through. So the following topics that I will I'll just mention now will be covered in today's session, so I'm not going to cover them now in this part of the talk. And so that will be, someone asked about eating well on a low budget, so we'll cover that in part 4 of today's presentation. How much protein do we need? That will be covered in part 2. Shouldn't we be eating more protein than carbohydrates? Again, that will be covered in part 2. Can I use vitamin supplements to support my nutritional needs? That will be covered in part 2 as well. And someone asked about a carnivore diet. So hopefully you'll be able to get that information and the answers to those questions as the presentation progresses. Someone also asked about how to lower cholesterol levels, and this will be covered in session 4, so next week in great depth. So I haven't really answered that question today because we'll be doing it in great depth next week. So hopefully you'll be able to join us to get that information. There was another question about adolescence and nutrition. And again, I think there is scope to have a session specifically around adolescent nutrition. Some of the basic principles that we've already covered in session 1 and session 2 will be relevant to the adolescents, but I think in terms of adolescents, it's more the behavior around choices of food. I think that is a big issue that we need to address. So I think Stuart, just taking note, maybe to arrange a talk, a session, maybe like this, to specifically look at that, so that we can really speak to those behavioral, problems and support the adolescents with their nutritional choices. There was also a question about having access to one-to-one or a list of nutritionists to work with. So at the moment, specifically to sickle cell, sickle cell is, nutrition is an emerging specialty in dietetics. So we don't really have a list of dietitians that have the knowledge that I have with sickle cell. This is something that we're looking at setting up. But there is a list of freelance dietitians that if you still wanted to get some extra help and support, that you can contact. So if you just Googled freelance dietitians, you'll be able to get a list. But if you're looking for someone with specialist knowledge of sickle cell, you're not going to get that, because this is an emerging area and the work that I'm doing is still very new. But hopefully we will be able to get you some help, and hopefully this course will have given you some information to go on with. So moving on to some of the specific questions that were asked as well. So someone asked about healthy weight loss in sickle cell, in particular looking at intermittent fasting, and if this is okay for sickle cell patients to have. And the answer is yes, intermittent fasting would be okay if you're living with sickle cell in terms of weight loss. The thing to remember with weight loss in sickle cell is that the preference is for steady weight loss, because if you lose weight too quickly, we've said last week that sickle cell patients have a high prevalence of gallstones, and that's due to the sickling process, but also for some patients, if they lose weight quite quickly, that can also predispose them to developing gallstones. So you definitely want to ensure that your weight loss is slow and steady to reduce the risk of developing gallstones. If you are following an intermittent fasting sort of approach, then definitely don't stay without food for more than 16 hours. And during the time that you are eating, to ensure that you're maintaining your nutrient and your food intake and also your fluid intake, because we know that dehydration is a trigger for sickle cell crisis. So the answer is yes, you can, but obviously just ensuring that you're still able to get in the nutrients that is needed for good health. In terms of healthy weight loss without compromising your nutritional needs. So as I've said in previous slides, it is important to follow a healthy, balanced diet. So as I mentioned, you're looking at eating the right amounts of foods, the right types of foods, the variety of foods, as I've mentioned in previous slide. We also want to focus on energy balance. And so that is ensuring that the energy that you take in through your diet is less than the energy that you are then using. And so that creates what we call an energy deficit. And it's that energy deficit that actually helps to facilitate the weight loss. So paying attention to how much you're taking in. And energy-rich foods, in particular, we're looking at carbohydrate foods, foods from the fats groups, or oils, healthy fats and healthy oils, and also alcohol. And there's a slide earlier or coming up that will show you the amount of calories per gram of carbohydrate, per gram of fat, per gram of carbohydrates, and that will give you more information to help you make an informed decision. And just remembering portion sizes, because remember, if you want to create this energy deficit, if you're having, the same amount of portion sizes you normally have, that's not going to help you lose weight. So you do need to adjust the portion sizes, how much you're eating, thinking about calorie control. Last week, I mentioned the Carbs and Calories book. That's a really good resource that I normally recommend to patients to have, because it does identify over 1,000 different foods, the carbohydrate content, the calorie content, the protein content as well. So that's a really good resource for you if you're living with sickle cell and you're wanting to lose weight. But also don't forget your lifestyle factors in terms of activity, because you want to be increasing your ability to burn the calories that you're taking in. So lifestyle factors is also important. So hopefully that answers that question. So someone asked about the thyroid and pulmonary embolism in sickle cell. So the thyroid gland, we know that all the organs in the body can be affected by sickle cell, particularly with the sickling, the vaso-occlusive crisis. But problems with the thyroid in sickle cell, there is low, but they do recommend that they monitor the risk. So also, as I mentioned earlier on, to consider organ damage. So if you know that you have, frequent sickle cell crisis, then definitely that can increase your risk of organ damage and tissue damage. So that's something to bear in mind. Thinking about if you're on regular blood transfusions, that can also increase your risk of iron overload. Iron overload, we know, can be deposited in organs such as the thyroid, such as the liver, such as the heart. So definitely, if you know that you have iron overload, potentially, the thyroid could be affected. So again, that's something to discuss with your healthcare, with your consultant. But also certain medications can also increase, affect your thyroid function. So it's just to be mindful. But overall, there is a low prevalence of impaired or hypothyroidism in sickle cell. With pulmonary embolism, so that's essentially a clot in the lungs. So pulmonary refers to the lungs, the clot in the lungs. So the question is, are you on blood thinners? If you are on blood thinners, particularly warfarin, then you need to avoid vitamin K rich foods and also alcohol. I was fortunate or unfortunate to be on warfarin for a very long time. So if you are on warfarin specifically, then pay attention to vitamin K rich foods, particularly broccoli or green leafy veggies. That can definitely reduce how effective warfarin is, but also alcohol can increase it. And I think what's the other food? Cranberries can increase how the functioning of warfarin as well. So just to be mindful of that. And then the last question, there was a question about how to manage cardiac issues as well as AVN, so avascular necrosis, through diet when living with sickle cell disease. And so essentially the answer to that is to ensure that you build a good nutritional status. That is important for everybody, but certainly, when you're living with complications associated with sickle cell. So it's important that you follow a healthy, balanced diet to reduce the risk of the frequency and the duration of sickle cell crisis. So you definitely want to reduce, the sickle cell crisis, because it's that blockage of the large and small blood vessels that ends up in the reduction of blood flow, the obstruction of blood flow that can affect the tissue organ damage, and we want to reduce that as much as possible. So specifically thinking about cardiac complications secondary to vaso-occlusion or to crisis, you will see it's very similar to if you have AVN complications secondary to vaso-occlusion. Healthy, balanced diet, eating a healthy, balanced diet is important, thinking about the types of foods, the amounts of foods, the variety of foods, as I've mentioned earlier, ensuring that you are healthy weight. Choosing healthy fats is important. We mentioned that in session 2 as well. In making sure that you are the lifestyle factors in terms of activity, having regular activity. We spoke about that a little bit last week as well. But also, if you're living with sickle cell and you are smoking, then my advice is, and there's another slide coming up speaking about the effects of smoking, then I highly recommend that you do stop smoking. And don't tell me that I only smoke 1 or 2 cigarettes. You're still smoking, and so definitely that is something I would say to not do. And as you can see in my answer there, the advice is the same for both the cardiac as well as the AVN complications: healthy, balanced diet, healthy weight. So just with the AVN, because we know obviously it affects the bones, so we want to consider bone health. We want to ensure that we get the nutrients in, but the calcium, the vitamin D that we know is important for bone health. So just making sure that you're following that on a day-to-day basis.
Claudine,
Good.
quick interjection just before we go on to part 2. Is it possible for you to hide the bottom taskbar? Just people are missing off the bottom bullet points on your slides.
Right. How do I do that? That's a good point.
It's a good question. I'm not too
I'm
sure.
not sure. I'm sorry about that. Gosh, how do I do that?
If anyone knows, if you pop
If
it in the
anyone
chat,
knows, please let me know.
I
Unless
will
I go out and
interject
come
again.
back in and see if it will change. Shall I do that? Like stop sharing and reshare?
You can try, yeah.
Shall I
If no one knows how to do it, we may just need to ask
No,
you.
if you right click on the bar and
Yeah.
then some options will come up and it says hiding on. So right click on it.
Oops. Oh, there you go. Oh, well. Oh, fantastic.
Winner.
Thank
Thank you.
Amazing. So we all good? Fantastic. Brilliant. So yeah, so that's the end of part 1, and hopefully I would have answered most of the questions, and as I said, some of the other questions will be answered as we go through the rest of the presentation. So we'll go on to part 2 now. So this is all about understanding nutrient deficiencies, and again we would have touched on a lot of this already in session 1 and session 2, but again, it's just helpful again to recap, and for those of you joining for the first time, it will be helpful for you to just have the overall knowledge as well. So looking at the nutritional features in sickle cell disease, and this again relates to the slide that I highlighted on the clinical features that's linked to sickle cell. So most of what I will talk about now relates to what are those the nutritional implications that's linked to those clinical features. And one of the main features there for sickle cell patients is the fact that they have what's called a high resting energy expenditure. And all that means is that you use a lot of energy even though you are at rest. So for many sickle patients, that is a problem, particularly those with SS, And those that present with a lower BMI, you will have this higher resting energy expenditure, and that will increase your need for more energy in your diet. So that's something to be aware of. For many patients as well, you will experience a high protein turnover, so you'll be using more energy or more protein to make these red blood cells, because we know that with sickle cell, the red blood cell, the half-life of red blood cells normally for non-sickle patients will be about 120 days. If you're living with sickle cell, that's reduced significantly down to 16 to 31 days. So this is high protein turnover, but also there's increased protein requirements for repair and for making new red blood cells. The fact that you have low oxygen levels in the blood means that the heart is to work so much harder to pump the blood around the body. So this increased cardiac demand and expenditure. We've already mentioned the impaired immunity, and that's because of the impaired functioning of the spleen. As I said, some patients may have a lower body mass index, and the body mass index, that was the answer to one of the questions earlier on. How do you calculate the body mass index? You use the weight over height squared, and that gives you that ratio, and that just says, gives us information about whether you are healthy weight or not. And then increased oxidative stress, which is an imbalance of harmful substances in the blood that can result in damage of the membranes of cells, and this can also lead to chronic inflammation. So this is sort of the main some of the main nutritional implications linked to sickle cell disease. So again, you would have seen this in previous slides, but the nutrient deficiencies affects both the macronutrients, macro meaning large, so that is your carbohydrates and your proteins and fats, so the energy producing foods, and also fluid. And we know that in sickle cell, there's an increased fluid requirement for patients. And then also your micronutrients. So these are the micro meaning small. And so this relates to your vitamins and your minerals, and predominantly the literature showing that patients will have deficient levels of zinc, selenium, vitamin D, your antioxidant vitamins A, C, and E, B vitamins, including folic acid, iron as well, but particularly we have to pay attention if it's in the absence of iron overload, because we know, that is a problem for patients on top-up blood transfusions. But also omega-3 fatty acids is also a nutrient that can be deficient in sickle cell patients. So this is a slide that I wanted to include in the presentation, because obviously there was that question about, how much protein do we need to take in the diet? And so this slide essentially is an overview of the energy distribution in a normal healthy diet. And this is based on a 2,000 average intake of 2,000 calories. So again, 2,000 is average. So if you're living with sickle cell, again, it can vary, and normally we'd be looking at sort of what the individual energy requirements are for patients. But just to give you, to explain and to give you this basic information, I've included this slide. And so looking at carbohydrates, so 1 gram of carbohydrates will give you 4 calories. And again, looking at the energy distribution from the carbohydrates, usually that is 50% of your total energy intake. So if you are looking at a 2,000 calorie intake, 50% of that would be 1,000 calories, as an example. So looking at the fat, 1 gram of fat is 9 calories. So you can see it's very energy dense, very rich, and it's nearly double the amount of carbohydrates. And so the total amount of fats from this normal energy distribution would be a total of up to 30%. And again, that can vary depending on the patient, but this is just, your average healthy diet. And if you're looking at protein, 1 gram of protein will give you 4 kilocalories. So it's the same as your carbohydrates. And so you can see that, fat is nearly more than double the amount of energy from 1 gram of fat. And then if you're looking at protein as well, so that is 20% of your total energy intake if you're basing that on a 2,000 calorie intake diet. And as I said, this is just for information to give you an indication of how much food energy should be provided from those main macronutrients, the carbohydrates, the fats, and the protein. So I've included this slide, again, it's just to give you sort of an overview of the function of the main foods, and we spoke about this in session 2 as well, and in session 1, the daily servings. And again, this is just an overview of trying to sort of factor in people with different energy levels, but just to give you a starting point, and then some information about what is a serving. So if you're looking at the food groups, and again, this is the looking at the main the 5 main food groups. So looking at bread, cereals, rice, and pasta, so that's your carbohydrates group in your foods. This provides energy and fiber, and the recommended sort of daily servings in this group is 5 to 14 servings, again, depending on your energy requirements. If you're trying to gain weight, then definitely the more servings you have would be better, because that means you'll be taking in more energy. If you're trying to lose weight, then having less of the daily servings would be preferable, because obviously we're trying to create that energy deficit that I mentioned earlier on. So what is a serving? 1 slice of wholemeal bread, 1 egg-sized potato, and you'll see that potatoes and sweet potatoes does not come in the fruits and vegetables section, but it does come under the energy or the carbohydrate section. 3 tablespoons of a breakfast cereal, 2 heaped tablespoons of cooked pasta, just to give you a guide. So if you're looking at your vegetables and your fruit, again, predominantly the nutrients provided there would be your vitamins, and as well as your antioxidants, vitamins A, C, and E, as I mentioned earlier. So 2 to 3 servings as part of your 5 a day for both the fruit and vegetables. So depending on, you may have 2 fruits and 3 veg. You may have, some people prefer veg, have 4 veg and 1 fruit, but remember, it's always about the variety as well. And then you'll see in the table there what is an average serving size. So if you're looking at vegetables, 1 medium-sized mixed salad can be a serving, 3 to 4 that would probably tablespoons of cooked vegetables, 150 mils of vegetable juice, 150 mils of fruit juice. And if you're having a smoothie, that will be the same, 150 mils of a fruit smoothie, 1 medium fresh fruit, 2 satsumas or kiwis, 7 strawberries. So it's just to give you an idea of what is a serving. If you're looking at the milk, yogurts and cheese, again, you'll get the main nutrients from this group will be your calcium and vitamin D. 2 to 3 servings is recommended there, and you'll see what is a serving size. 200 mils for semi-skimmed milk, 240 for milk alternatives, so that's your soya or your almond or your what's the other one, oat milk or almond milk. 150 grams for low-fat yogurt, 125 grams for cottage cheese, 40 grams for hard cheese. If you're thinking about your poultry, your meat, your protein group, and that's important for growth, repair, and health. We looked at that last time as well. Again, 2 to 3 servings, and there you'll see the examples of what a serving looks like. 85 to 100 grams of cooked poultry, fish and lean meat, a half a cup or 80 grams of cooked dry beans, 100 gram or palm-sized portion of tofu, 2 eggs, 2 tablespoons of peanut butter, 3 tablespoons of nuts or seeds. So hopefully you would have found this slide helpful. So when we're looking at some of the vitamin food sources, again, I'll just talk you through. And again, we've looked at this in session 1 and session 2. So I'll just briefly talk you through. So for vitamin A, again, you aiming for dark green veg, yellow, orange veg, tomatoes, watermelon, apricots, and peaches. Vitamin C, Vitamins A, C, and E, just to say, they are your key antioxidants. So for vitamin C, broccoli, green leafy veg, peppers, citrus, fruits, berries, cantaloupe, strawberries are good examples there. You may see foods that you're already having, if there's any gaps, as I said last time, then, make sure to increase and widen the variety of the foods that you're having. Vitamin E, avocado, vegetables, eggs, grains, nuts, and seeds. Um, Vitamin D, I've included that as well. So oily fish, eggs, yogurts, cod liver oil, fortified foods. Sunlight, we would want to have more sunlight. That is a really good source of vitamin D, but we know obviously we don't have a lot of sunlight. And so the recommendation is for sickle cell patients to have a 10 microgram supplement daily, and that is equivalent of 400 international units. And then other antioxidant foods includes foods or herbs such as cloves, olive oil, nutmeg, cumin, garlic, and ginger. There's another slide that's to follow that also gives you more information about this as well. So I've included the next two slides to talk a little bit more about folic acid because, sorry, I know some of you may be taking your folic acid supplement, and other people may be taking getting their folic acid from their diet. So I've included this slides just for those patients who want to try and increase their folic acid through their diet. So these two slides is to provide you with that information. So it is a B vitamin, as I've mentioned earlier on, and it is vital and important in order to help you to make more red blood cells, because we know that you've got this chronic hemolysis, this ongoing breakdown of your red blood cells. And the way that we want to do that is by eating a well-balanced diet. I can't stress enough. Eating a variety of the foods, eating foods from your 5 food groups. And I'll share a slide again of the Eat Well guide in I think part 3, but also ensuring that you get a balance of the nutrients needed for good health. So that's sort of the principles that we're building this information on. So what are some of the food sources that will help you to ensure that you can increase your daily folic acid intake through your diet? So green leafy veg like spinach, kale, cabbage, spring greens, and broccoli are good sources to ensure that you're getting a good amount of folic acid. Cruciferous vegetables like Brussels sprouts and asparagus, and not only have Brussels sprouts at Christmas, try and have it. I love Brussels sprouts, and I have it whether it's Christmas or not. So definitely getting in my folic acid that way. Beans and peas, like chickpeas, kidney beans, black-eyed peas, and lentils is a good source as well. Your citrus fruits, oranges, tropical fruits like papaya and bananas. Fortified food. So when you're buying breakfast cereals, make sure and just check that it says that it's been fortified with folic acid, and that will be a better source for you to choose. So breakfast cereals are generally fortified. Some breads and flours have also been fortified. So make sure that you read your label to see whether these foods have been fortified. Cornmeal, pasta, rice, other grain products, and again, make sure that it says that it's been fortified. And other foods like liver, eggs, dairy products, meat, poultry, shellfish, avocado, and whole wheat. So as you can see from this list, there's a range of foods, whether you're following normal diet or whether you're following vegan, vegetarian, there's a range of foods that you can take in on a daily basis to ensure that you get a good amount of folic acid in your diet. So looking at mineral food sources as well, again, zinc, sources of zinc would be pecan nuts, black-eyed peas, eggs, fish, poultry, herring, and oysters. With selenium, Brazils, so not having more than 5 Brazil nuts to reduce the risk of toxicity, tuna, Again, fish, organ meat. So if you're following a vegan diet, then your best bet would be to get the zinc and selenium through a supplement. And then other examples of magnesium would be nuts, whole grains, beans, dairy products, meat and fish. So yeah, as I said, if you do follow a vegan or vegetarian diet, then it may be that you would benefit from having a vitamin and mineral that can ensure that you actually get in these nutrients. So omega-3 sources through your diet. And again, omega-3 is important as an anti-inflammatory. So your oily fish, walnuts, flax seeds, salmon. Many people don't like eating the fish, so there are plant options that you can have: flax seeds, chia seeds, hemp oil, soybean oil, walnuts, canola oil. So these are also good examples, and to ensure that at least that you have 2 portions of oily fish a week to ensure that you get in your omega-3 this way. So that's the end of part 2. So hopefully, again, for those people who've had questions around supplements and around vitamin and mineral nutrients, that you would have a good grounding for that. So if we're moving on to part 3 now, so this will be the bulk of this evening's presentation. So looking at additional factors linking nutrition to health and well-being. And I'll keep an eye on the time so that we can try and keep, finish on time as well. So many of you would have seen the Sickle Cell Nutrition Eat Well Guide, and I've included this again just in case there's someone who's joined today for the first time. So this is our Sickle Cell Nutrition Eat Well Guide that's been co-developed by myself as alongside sickle cell patients. And the important thing here, it is tailored to your nutritional needs living with sickle cell. And what's nice about the Sickle Cell Eat Well Guide, as I've mentioned before, it does include not only the foods, that reflects your cultural foods, but also key nutritional messages that's important for you to be aware of when you're living with sickle cell. And as I mentioned last week as well, there are 7 key messages or principles that have been included in the Eat Well Guide. And the 7 key messages here are, if you're looking at the orange group, the yellow group, which is your energy food. So the importance of you increasing your energy intake, because we know that patients can have a higher resting energy requirement, and so you will potentially have higher energy needs. Increasing your protein intake. So if you're looking at the purple group there, so to ensure that you could get a good amount of protein to ensure that you, obviously you meet your protein requirements on a day-to-day basis. Regulating your immunity, including antioxidants and reducing inflammation. And that messaging you'd find in the fruit and vegetables, so the green section there. Improving your bone health, that will be in relation to your dairy products, so the blue group over there. Preventing dehydration, so ensuring that you're taking in enough fluid, as we mentioned last week as well. And then choosing healthy options, so making sure that you are not taking in too much of foods, the processed foods or foods that are high in fat and sugar. So what's also important is that you consider your nutritional goals, because again, not everybody will have the same nutritional risks or concerns. And so this slide is just to get you to be thinking about what are your concerns, what are your problems you're experiencing? Is it that you need to improve your appetite because you have a poor appetite? Is it that you need to gain weight? Is it that you need to lose weight? Because you're outside of the healthy weight range? Is it that you are struggling to maintain your energy levels because you're struggling with chronic anemia and fatigue? Are you experiencing increased infection risks or multiple infections? Are you experiencing menopause or symptoms of menopause and problems associated with that? Or in addition to your sickle cell, you have other long-term conditions like diabetes or, high blood pressure or heart disease, etc. So it's important that you think about, what are your nutritional goals? And particularly in this section, we'll be looking at some of those factors as well. So I mentioned earlier on, in terms of sickle cell, to the importance of avoiding and stopping smoking if you are smoking. And the reason why is that smoking can damage your blood vessels. And we know that with sickle cell, you have this chronic hemolysis, you have this ongoing vaso-occlusion. So you already have blockage of your blood vessels. And if you are smoking and you're having regular ongoing crises, you are just setting yourself up for a lot of problems. So my advice would be to, as I said, avoid smoking or quitting smoking. And obviously you can get help from your GP practice with that. So it causes damage to your blood vessels. It causes plaques to build up in your arteries, so narrowing the blood flow, which we know is a problem as a consequence of the vaso-occlusion that you experience with the crisis. It can increase your blood pressure, and we spoke about patients having an increased risk of renal or renal nephropathy, where high blood pressure can make that can worsen the effects of that. So if you're smoking, you can just be adding to those risks, and can also increase your heart rate. And so for those on the call, please consider stopping or quitting, and obviously getting help with that. The next couple of slides we'll be looking at nutrition and as an act of self-care. These next couple of slides, I actually did it as a talk, to sickle cell patients before, and I felt like it was important for me to bring this information and awareness as part of the series as well, because nutrition isn't, as I said earlier on, is not just about food. There are so many other factors that we need to consider that can impact on your nutritional needs. And so what is self-care? Anything that improves your quality of life. And when I looked at quality of life, I came across a definition of quality of life by the World Health Organization. And that definition is, it's an individual's perception of their position in life in the context of their culture. So culture normally refers to the way that we normally do things, and also our value systems, our beliefs about particular thing, and in relation to goals, expectations, standards, and concerns. And so this next slide is then to take that definition further, expand on it a little bit. So I'm going to ask you a number of questions in relation to your goals, expectations, standards, and concerns, as this can influence your quality of life. So starting with goals. For those of you who've been part of the course now from week one, have you set goals for yourself? Have you set goals for your health and well-being? Have you set goals in terms of your nutrition? If you haven't, then I want to encourage you from today to set specific goals in relation to your health and your well-being, in terms of your nutrition, in terms of your nutritional status, in terms of your nutritional problems that you've identified that you experience. Thinking about your expectations. What is influencing your expectations? Do you have expectations? And I really want to encourage you to think about your expectations in terms of your overall health, expectations in terms of your nutritional health, in terms of your quality of life. Do you have expectations? Do you have standards? What standards have you set for yourself? Or are you just happy with the status quo? Or are you just going, the way, just going, what's the word? Just taking every day as it comes without thinking. What are the standards that you set for yourself? Do you have standards? And if not, I want to encourage you to take note and set some standards for you. What are your concerns, and how do you manage your concerns? And again, is there something that you've thought of, and what are you doing about that? So moving on, thinking about self-care. So what is some of the general advice to think about in the context of self-care? So healthy diet, we're not going to go into that because we've been talking, this is all that we've been talking about so far. Regular exercise and activity, something we've already been mentioning. What about sleep? Are you sleeping well? Are you sleeping your 8 hours a day, or are you sleeping 3 or 4 hours a day? Are you relaxing? Are you making time to relax? Are you making time to create a sleeping an environment that will enable you to achieve and sleep for the amount of time that we know is important? Questions, food for thought. Put some, let me know in the comments if you're already doing some of these really important self-care practices. And then in terms of treatment, CBT, cognitive behavioral therapy, and for those of you who are tapping in to psychological services may already be having or undergoing some of these treatments, getting advice on sleep if that is a problem that you're experiencing. You may also need to have some blood tests, to understand. It may be that, some of your vitamins and minerals may be low, and blood tests may be able to give you that information. Your hemoglobin levels may be lower than normal. So what are you doing? Put it in the chat so that I can know what you're doing. The next two slides, again, it seems complicated, but all I tried to do with this slide was just to show how your quality of life in terms of self-care links up with your health and well-being, and how nutrition is at the center of that. And knowing as well that if you think about the context of who we are, that we are, spiritual beings, our physical health and well-being also plays a role. Our emotional health and well-being, as well as our mental health and well-being, are factors, and all of these together can impact on our nutritional health. So when you're thinking about health, your self-care, and you're thinking about nutrition, it's important that you're thinking about your spiritual health and well-being, your beliefs, your control, the factors that control your beliefs, your diet and lifestyle, your happiness, your decisions and your actions that help you to be happy, and also, what keeps you motivated, your decision and actions that help you to keep motivated. So thinking about your holistic health and well-being and how that impacts on your overall health and well-being. So adding in your social environment, your social support, your networks. Do you feel that you belong to a network? Do you have support structures? Are you engaging with, other groups? What about finances? And we'll talk about that a little bit in a bit more detail, because we know that, food insecurity, having enough money to buy the food that you need is important. And also the environment that you find yourself, all of those factors, in addition to the spiritual, physical, emotional, mental, all of these together, contribute to your overall quality of life, and also therefore your overall health and well-being outcomes, and nutrition is at the center of that. So I've added in the slides because I know many of you will ask and have questions about herbs and supplements. Now, my knowledge on this is limited. But I know there's a lot of you that will have questions, and probably using herbs and supplements as part of your normal diet. And if you are, put it in the chat. And I've just listed a few of the herbs and supplements. I think I mentioned some of them earlier on, that you could consider including in your diet, that can contribute to increasing your anti-inflammatory effects of the body, improving your antioxidant intake, boosting energy, and also improving your circulation. So herbs like cinnamon, cloves, garlic, ginger, cayenne pepper, turmeric, chili peppers, ginseng, ginkgo biloba, green tea, rosemary. Some of you may already be using that. I'm using some of that in my diet as well. And so again, it was just to sort of highlight that, these are some of the extra things that you can include in your diet that can add to, how your body, how the intake, the nutrients that you can intake to improve your overall health and well-being. Right, so that's the end of part 3. So hopefully you will, with part 3, have seen how nutrition, health, and well-being all connects, and you will go away and think about your goals, your standards, and your concerns and your expectations in relation to your health and well-being. So we'll move on to part 4, which is living well with sickle cell. So the next couple of slides, again, will take you through specific aspects of helping you to live well with sickle cell. And I'm going to start off with planning for healthy eating, because you would have heard the saying, if you fail to plan, you plan to fail. And so even with healthy eating, it's really important that you plan, you take the time to plan that. And again, this planning would be helpful in terms of those 7 key healthy guidance or principles that I've identified that is in the Eat Well guide that I've mentioned earlier on. The first 3 points is essentially, I don't know if you've heard of Stephen Covey. He's a leadership guru. And he's written a book called The Habits of Highly Effective People. And I've borrowed the first 3 points I've borrowed 3 of those 7 habits that he identifies in his book. And one of the first things that he says is first things first. And I want to now encourage you to prioritize your health. So make health, make nutrition your priority. Yeah. One of the things he also mentions is beginning with the end in mind. So what is the end that you're looking at? What is it that you want to achieve in terms of your overall health and well-being? Start there. And that is identify your health goals. What are your health goals? Do you have those? I've already asked you those questions. Do you have them? Put them in the chat if you have. If not, start thinking about them. So first things first, prioritize your health. Begin with the end in mind, identify your health goals. And then thirdly, be proactive. Consider self-management options. And as I said, the next couple of slides will give you some extra information to help you do that. It's important to make wise decisions in terms of choosing healthy options. And by now, you should have quite a lot of information to enable you, to empower you to be able to start making and choosing healthy options. Preparation and planning is key. As I said, if you fail to plan, you plan to fail. So do your homework. If you haven't got those, if you haven't done any planning, then I want to encourage you to start now. Do the planning, with the images there. Use colorful stickers, colorful post-it notes. I normally get my patients to use colorful post-it notes to write out their goals and to keep it quite visual. So the same for you, write out your plans, write it on colorful sticky notes, and put it up around the house so that you can be reminded of your goals and what you're working towards on a day-to-day basis. And very importantly, don't do it alone. Ask for help. I know, it's really easy to sort of think, it's my problem and I have to do this on my own. You don't really need to do it on your own. Ask your sickle cell nurse, or, your support group, or, people in your network to help you do this. But it's really key that you take the time to plan for healthy eating. So the next couple of slides will just be giving you some healthy breakfast, healthy lunch, and healthy dinner ideas. Some pictures is always helpful sometimes to see some images. So you may be able to recognize some of the things you're already doing. So in this image there, there's example of whole grain cereals that you potentially could be having. Some people I know in the morning they can't eat, so they have a healthy smoothie. So maybe that's something that you can consider if you don't have a lot of time or you don't like eating, so you can have that. Or you can have an egg or a sandwich over there. So this is just examples to show you of what you potentially could include as a healthy breakfast. So this slide, again, some more ideas, having a piece of fruit, having an omelette, if you like eggs in the morning and you've got some time, having an omelette, having some veggies, salad veg along with that, maybe having some French toast as an example. You know, there's lots of ways that you can ensure that you can, you know, ensure that you have a healthy diet. What about healthy lunch ideas? And again, I've included, tried to include a variety. For some people, it may be that they have a healthy salad. For others, it may be that they have a sandwich and they have it, like in this image there, you know, a selection of tomatoes, cucumbers, berries, grapes, etc. Or it may be that you have a pizza. And again, portion sizes, going for a healthier option. You know, there's nothing wrong with having a pizza. If you're having a whole pizza, that might be a problem because obviously the more you have, that will increase your, you know, calorie intake. Why not make a pizza at home and have that as a healthy lunch option? Again, other examples, having a pizza, having a wrap, making that from scratch, having a sandwich. I love avocado and egg, boiled egg as an example. So what are you doing? Are you doing some of the things I'm identifying here? Are you having traditional foods? Are you having leftovers? But if you're having leftovers, just make sure, again, that you're still getting in that variety of foods that will give you the mix of nutrients that you need for good health. What about healthy dinner options? You know, you can have stir fries. I love stir fries. Once a week, at least in our family, we have stir fry, and there's prawns, and I've included prawns because I tend to have prawns. But you know, you can have, you know, whatever options that you know that you enjoy. It could be your tofu, could be tempeh, could be quinoa. You know, you decide. Other examples could be soup. Some people enjoy soup. Some people enjoy fish. What do you enjoy eating? But again, using the principles of the Eat Well guide to ensure that you get the right variety, that you get the right amounts of foods that you're getting in to address those nutritional needs that we know are problems when you're living with sickle cell. What about healthy snacks? Now, in this slide, if you're looking closely, you will see there's some not so healthy options. I wanted to check, just to check to see if you are paying attention. But again, if you want to have a s'mores, like example there, or if you want to have some crisps, we're not saying that you can't have it, but we're saying if you have it less often, have a small portion, have some popcorn, have some nuts. You know, these are all examples that can become part of a healthy, balanced diet. So other options for healthy snacks, again, having some fruit, have banana, an apple a day. People say believe in apple a day keeps the doctor away. I don't know if you're one of those people, but yeah, having a mix of healthy fruits. Definitely, these are examples of healthy snacks. You may have other examples as well. Again, in the chat, if you want to put in some of your examples, that will be fantastic. But this is just to give you an idea of what that might look like. So now we've looked at planning for healthy eating. We've looked at examples for healthy eating. So now budgeting for a healthy diet, because I know this is a question that many people say, I can't eat healthy because it's expensive. We know that it is expensive, and that's why we're planning. That's why we started off this presentation with planning for healthy eating. And then so we know how much money we have available. I have to plan my budget, weekly budget, you know, to ensure that I stay within the money that I have available. So what does that look like? So planning is key, as we've already mentioned. Make a meal plan and a shopping list. So a meal plan, all I'm saying there is, what are the meals that you would commonly have, per week on a day-to-day basis, and then you plan your shopping list accordingly. So that's what I do as an example. And I sent my husband to the shop with that shopping list to ensure that we stay to our budget and we stay to the list so that we can, not go outside of the budget that we've set. I always check the cupboards, check to see what you already have in the cupboard, so that, you don't have to buy things that that you've already have in the house. Tinned foods, frozen foods, dried options, definitely that is what I include in my shopping list as well. And it is a very easy way that we can stay within a budget. So definitely tinned, frozen, dried options. Those are options that you can include in your diet that will still ensure that you're getting a reasonably good amount of nutrients. And we touched on that in our last section or last session as well. Choosing value or shop brands as much as possible. Again, that's something that I do, and it works really well for me. It helps me to stay on budget. So that is something that I would recommend that you do if you're not already doing that. So try not to go for the top brand names. You can get the same quality in your value brand as well as the shop brands. Cooking from scratch. Now we know that time is a factor, but again, if we're planning, hopefully we can plan in so that we do have the time to be able to prepare meals from scratch as much as possible. Sometimes it's not possible, but if you aim and you plan that is the way that you do it, I think that will definitely make a difference. Limiting takeout meals. Again, if you have a small budget, eating out can be very expensive. So you want to make sure that you are having meals that you can prepare from scratch in your air fryer, if you're an air fryer type of person. And then preparing lunch options at home as well. That can definitely go a long way to try and keep your budget. And certainly if you have a family and with children at school, etc., that will definitely help to ensure that you stay within a budget. So I mentioned store cupboard ideas. So having things like eggs at home, having your tinned foods, your dried pulses at home, having your spices and all of those, having flour, having pasta, all of those dried ingredients that you can buy in bulk, having those kinds of foods in your cupboard would go a long way to try and keep the budget, as manageable as possible. So as I mentioned, having flour, having pasta, having your herbs and your spices at home, definitely that will help. If you can buy in bulk so that you don't have to buy sort of on an ongoing basis, that can also definitely help to try and keep you on a tight budget. Good. So now we've learned about planning to eat healthy. We've learned about budgeting to eat healthy. Now the next couple of slides are going to be all about living well with fatigue. And again, this is the presentation that I did, and I felt it was really helpful just to share it as part of this evening's presentation, because this we know is one of the most common symptoms and problems that many sickle cell patients experience. So very briefly, what is fatigue? It's a feeling of constant exhaustion, burnout, lack of energy. It can be experienced as a physical symptom, can be mental, and can also be a combination of both. Some of the general causes of fatigue. So some of you may know this already, but I'll just go through it very briefly. Having a lack of sleep, so not sleeping those 8 hours, as we mentioned earlier on. Stress, depression, bereavement, all of these factors can also contribute to feelings of fatigue. Living an unhealthy lifestyle in terms of diet, in terms of activity, that can also contribute to feelings of fatigue. Hormonal changes, some illnesses, and medical problems consequences of your, you're living with sickle cell, iron deficiency, anemia, diabetes, overactive thyroid, all of these other factors can also contribute to your feelings of fatigue or how you experience fatigue. So just a self-help plan to help you manage this a little bit better. So in terms of mindset, we know the mind is powerful. And so if we can choose to have a positive mindset, that will definitely help in terms of how we are able to manage the symptoms of fatigue. So having a positive attitude is really important. Setting daily intentions around having a positive attitude and managing your symptoms of fatigue is helpful, but also having a healthy diet and lifestyle as a foundation will definitely go a long way in terms of having a healthy mindset to help you manage your fatigue. Knowing what resources and help is available to you is very important, and that's part of planning. So plan ahead in terms of budgeting as well, but also having good support structures. I've mentioned that as well, having access to a support group if you're living with sickle cell in your local area, but also having peer support, family support. All of those will definitely help in terms of managing your symptoms of fatigue. So eating well when fatigued, and I've included this comment from one of the participants of my doctoral research that really sums up, the experiences of many of you living with symptoms of fatigue. So this participant said, "I suffer with lethargy and tiredness, and I don't feel like cooking every day. I'm really reliant on my family at home to do a lot of the cooking. My daughter keeps things chopped up in the fridge, so it's easily accessible." So when you are experiencing fatigue, eating well becomes so important, but also having the support of your family goes a long way to help you do this well. So what can you do? Like that comment, like that participant said, ask for help from family and friends. And I know it's really difficult because they may already be helping you with so many other things, but it's that's what's needed, isn't it? If you don't have access or support from family and friends, then maybe there can be befriending groups in the community that you can be in contact with that can offer some additional help as well. But the important thing is that you ask for help and find out what help is available in your area. Having healthy snacks to hand, like nuts, dried fruit, fresh fruit cut up, as that participant mentioned in the comment there, is a really helpful thing because you want to ensure that you can maintain good levels of energy. And by having snacks to hand, that can definitely help to increase your energy levels. Having nutritious drinks available, milk-based drinks or fruit smoothies definitely can help in terms of maintaining your energy levels, but also as a way of ensuring that you get a good mix of your vitamins and your minerals, particularly if you don't like eating, fresh fruits and vegetables. Having fruit smoothies can be a way that you can do that well. Be prepared, batch cook, prepare meals in advance, freeze meals. Again, that does require planning. It does require you having access to help. But, I've heard from people who say that that's what they do. They prepare their meals in advance and they freeze their meals so that when they are unwell or, if they know that they've got a full day, they can just take out the meals and that's a really important part of ensuring that you can live well with fatigue. Don't compromise on choosing healthy options, because I've heard so many sickle cell patients say, when I feel fatigued, I'm that exhausted that I grab anything in front of me. I go for the crisps, I go for the chocolate, I go for the biscuits. And that's why planning is so important, to ensure that you have access to healthy options. We know from the Eat Well guide that, we want to ensure healthy choices. And having these foods now and again, not a problem. But if you're experiencing fatigue on an ongoing basis and that's your go-to all the time, then definitely that is going to have an impact on the variety of the food that you're having, and also ensuring that you get the good mix of vitamins and minerals that you need for good health. As I said at the end, have a treat when you need to, but that shouldn't be your go-to. So eating well when you're unwell. So that sort of is all about eating well with fatigue. So we'll move on to eating well when you're just feeling unwell, basically. So again, maintaining good nutrition is important. Don't skip meals. It's so easy when you're not feeling well that food becomes less of a priority. We saw with, the first slide about planning, the prioritizing nutrition is really important. So make sure that you're maintaining good nutrition and don't skip meals, as I've mentioned. Consider the foods that you enjoy eating. When you're feeling unwell, what is it that you enjoy eating, and try and have those foods. It may be that during that time you choose your chocolate or your favorite cake or your favorite biscuit, and in those occasions, because you are taking in less food, the extra calories from those foods can help to address the energy requirements that you may need. Choose nutrient dense foods and snacks. So again, choosing foods that have a little bit more energy, a little bit more protein, that can definitely go a long way, particularly when you're not eating as much and you may have a reduced appetite as a consequence. As I said, choosing foods that are high in energy and protein, so starchy carbohydrates, healthy fats, nuts, avocado, seeds, having more milky drinks or milk alternatives for those people with lactose intolerance who don't normally have cow's milk. Avoid low energy foods and drinks. So don't go with skimmed milk. If you normally have skimmed milk when you're feeling unwell and you want to and you need to increase your energy intake, don't go for skimmed milk. Definitely go for the blue top. Because that way you're going to get in more protein, but you're also going to get more energy because of the extra fat that we find in the blue top milk. And then try to enrich or fortify your meals and snacks to get in those extra calories and protein. When you have a poor appetite, very similar to what I've just mentioned, maintain your energy and nutrient levels, maintain your nutritional status. And the way that you do that, as we said in the beginning, is to eat a healthy diet, reduce your risk of malnutrition. So eating little and often, because sometimes when you have a reduced appetite, you just can't stomach to have your normal plate. So eating little and often, eating 5 to 6 smaller meals throughout the day might be much more tolerated. Choosing high protein foods and snacks is definitely a better choice there. Fortifying your meals using grated cheese, or using pea or soy protein powder, stirring that into your food, that might be helpful as well. Having nourishing drinks, as I mentioned before, but also having energy dense snacks in between your meals, as this picture shows, nuts and seeds, having eggs, maybe having an omelette, maybe having eggy bread, having some crackers and cheese. All of those foods will definitely help to ensure that you're getting in more energy, more protein, and that will help to reduce your risk of malnutrition, will help to prevent a deterioration in your overall nutritional status. So eating well during and after a crisis, we know that when you are in crisis, the last thing you have in your mind is eating. But I really want to encourage you that that's the first thing that I want you to be thinking about. That's why you have to plan. That's why you need to have your colorful post-it notes around the house, so that when you are in crisis, you can catch the red or the pink post-it notes, and that can remind you that it is important for you to eat, even if it's a small amount. So I want you to reframe the importance of nutrition and prioritize the importance of nutrition when you are experiencing a crisis. We know that, I've heard this from so many patients, sickle cell patients, who have changed their diet, who are now eating and following a healthy, balanced diet, that they have observed for themselves a reduction in the the frequency of crisis, the severity of their crisis, the duration of their crisis. So I want you to, to encourage you to prioritize nutrition so that in the long term, you can have that benefit of having less crisis and so forth. So choosing foods that you enjoy, again, during that time when I can't stomach food, I can't think of food, what is it that you enjoy eating, and have those foods to hand. As I said, that's where the planning comes in. Having nourishing drinks. If you can't chew, if you can't have food, go for the drinks. Go for nourishing drinks, something like nourishment drink, having a smoothie. All of those things would be better than you not having anything. Definitely ensure that you have enough fluids, because we know that dehydration is a trigger for crisis. But when you are through that, ensure that you have nourishing drinks that will give you the protein, that will give you the energy and the vitamins and minerals that you need for good health. Eating smaller meals, having the snacks throughout the day, as I mentioned for the other, when you're unwell, if you have reduced appetite. And importantly, ask for help and support with meal preparation and snacks. So don't do this on your own, but definitely, aim to prioritize nutrition so that you can have the benefit of, in the long term, not having as many crises or to the same intensity as you may have in the past. So that's the end of session 4, and I hope you've been able to take notes, and you will go away with a lot of helpful strategies to help you live well with sickle cell. So now we've come to the final part, which is part 5, all about empowerment and lifestyle tips. And the next 2 slides is, again, just encouraging you about, general advice for self-care. We've spoken quite a lot about self-care, and we've spoken a lot that how nutrition can be an expression of your self-care, and also those many factors that can influence your self-care. We've spoken about healthy diet, so choosing healthy fats, lots of fruits and vegetables, whole grains. We've spoken about planning your meals, but in terms of budgeting, in terms of planning your meal plans, in terms of yes, spoken about a lot. Again, I want to reiterate the importance of regular activity, having a good sleep routine, having a good environment that is conducive to sleeping. Don't take your phone with you. Having regular relaxation, but definitely plan. What did I say? If you fail to plan, yes, I've confused myself, but you know what I mean. So definitely make sure that you are planning for healthy eating. And just finally, things not to do in terms of self-care. Don't smoke. Stop smoking. Avoid smoking. I've shared that slide, the impact of smoking. So definitely, I strongly advise you to stop smoking. Avoid alcohol. Avoid caffeine or exercise before sleeping. Avoid screen time during the hour or before you sleep. There's so many other things we've spoken about quite a lot. You may have your own self-care. If you've got tips, put it in the chat there as well. But hopefully you can take some of these tips on board moving forward. So just as per usual, I end off the presentation was just reminding you can go to the Sickle Cell Nutrition Academy website, look at the nutrition compendium. A lot of the information I've covered, in particularly part 5 or 4 or 5 of the presentation, comes from the nutrition compendium. So do go and have a look at the resources to get some more information about that as well. So one thing you will take away from this evening's presentation, put it in the chat. Thank you so much for those that have been putting one thing that they'll be taking away in the chats from the previous session. So what is it that you will take away from this evening's presentation? At least one thing, hopefully. So thank you once again. It's the end of the presentation. And as I said, hopefully you would have gained either a refresher from what I've shared or something new, or something that you've not thought of before that you can add to the knowledge you've gained over the last 3 sessions. And hopefully I'll get to see you on session 4 in a week's time. Thank you. I'll stop sharing now.